we know we can be innovative in other ways, but when we talk about the age of our facilities, I was a former nursing home administrator myself, and even then it's like, these long halls, and how can you be efficient in care when when you can't see everybody, et cetera. So I do see.
You think it's time for Medicaid expansion?
I think as one of the solutions, and probably one of the biggest, I think we need to take advantage of what's available.
What's necessary here is a Medicaid reform, and I think that needs to be the priority. So an example of that is we talk about long-term care, bottlenecks. At a critical access hospital, we provide swing bed care, which is really kind of a step down from an expensive tertiary unit to a nursing home when a patient needs that in-between hospitalization. Currently, Wisconsin Medicaid does not cover swing bed coverage. An example of an effective Medicaid reform may be Wisconsin Medicaid covering swing bed care to help release some of those bottlenecks. And it's an example of creative reform that's necessary, I think, as a priority when we look at Wisconsin Medicaid.
If given the results of the November election, if we're better positioned for something like Medicaid expansion and the $1.3 billion of additional money has come, great, we can do so much more. But for the purposes, and again, I'm only one vote on that task force, but for the purposes of that task force report come September, we should deal with the here and now, not what some of us, most of us, hope is the future.